April is National Organ Donor Awareness Month, and we're going to focus on some of the youngest patients. We're here with Dr. Julia Steinke. So why don't you tell us about your program and about kidney transplantation?
So we are the largest program in West Michigan. We've been nationally recognized by the U.S. News and World Report for the last few years. And kidney transplant offers a wonderful life-saving gift to children who suffer from kidney disease from a variety of causes.
How do you decide who exactly is going to get a kidney transplant?
That's a good question. So the first step is to determine the cause of the kidney disease, since some diseases do come back after a transplant. And we have to determine whether or not the patient's healthy enough and a suitable candidate. So they have to go through a number of evaluations, and that includes seeing other subspecialists, going through a number of imaging studies, laboratory tests, and then after that's all completed, then they go through the approval process. And then we decide whether or not the patient's ready for transplant, and we make that decision not unilaterally, but we make it as a group. We have a monthly meeting called the Transplant Selection Meeting, and all of the professionals at that meeting make that decision whether or not the child's ready. And then after that point, then they either are matched with their living donor, either related or unrelated, or they get put on a deceased donor list waiting for a kidney.
What are some of the benefits of a kidney transplant?
So the benefits are wonderful compared to what the child was going through beforehand. We try to avoid dialysis when necessary, but it offers them some normalcy in their life, getting back to a normal diet, no food restrictions, and back to the things they enjoy doing.